NSCA Strongman SIG, and today have the opportunity to be sitting down with Dr. Sam Spinelli. I believe that's how you pronounce it. He's a strength athlete, strength coach, but really we're going to talk to him today about his experience in physical therapy. He used to be known as the strength therapist, if I'm correct. And so his specialty is dealing with PT issues with strength athletes. Obviously, strongman is a strength sport, so I'm hoping he can kind of help clear up some issues that we see in strongman today. So that being said, Dr. Sam, introduce yourself. I want to know, what you are, who you are, your background in sports, strongman specifically. And we talked before, but you're not just really smart, like you actually compete and move some heavy weight, right?
Yeah. So I'm a doctor of physical therapy, strength and conditioning coach. Been doing this for a pretty long time. I've been coaching people for roughly 15 years. And I got my first start in strongman essentially when it came to some sort of competitive strength athletic. I grew up in a small town in rural Alberta, and there was the Strongman Association for Alberta. And that was a huge advantage just because I started to go to the gym and there's just a bunch of strongmen there. So when I got involved really early, it was just, they were teaching me a lot of the basics, helped me get started in the sport. And that developed over time to where I eventually got competing in strongman. I competed a few times in Alberta's Strongest Man, competed in a few other strongman events. I've done fairly well. I'm a smaller guy in strongman terms. I walk around 230 pounds. So I've generally competed at the under 231 and done fairly well, winning a lot of competitions for that. And then the last probably 7 years, I've mostly trained and competed in powerlifting, weightlifting, and Highland Games, mostly due to the nature of just having moved a lot. I was in school for physical therapy and couldn't really find a consistent training place that had strongman equipment. And I just was also short on time. And so then I just went in, hit basic stuff, and got out. Over the last couple of years, now that I've been out of school, I've started to get back towards doing some more strongman training and hoping to compete maybe next year if things go well in the world and finally have more competitions going. Locally, there's only been, I think, like one strongman event in my province this last year. So, hopefully we get a lot more going next year and I'll be able to jump in on a few. And I like to say I'm decently strong. I throw around, 300 plus pound snatches, 360 clean and jerks, deadlift close to 600 pounds, squat high fives, and got some decent lifts. So
you're not a weak doctor that you walk the walk.
I try to walk the walk. Yeah.
Before we get on the question, so do you find, I would just imagine, I think this is a rhetorical question, but do you find being active within the sport gives you an advantage over, say, doctors who just know about physiology?
I definitely say so. I think it's really common where a lot of healthcare professionals know physiology, know this other information, but then without any practice of it, they're just so foreign to the subjects. I'd say that if you'd at least been involved in some sort of strength thing, like a weightlifter, power lifter, you'd have a moderate amount of ability to transfer over to strongman from a standpoint of helping people in it. But most don't. The average doctor maybe runs, maybe lifts the occasional bicep curl, but has no concept of deadlifting, pressing, etc. And so they really don't have much ability to help a lot of people because, as I'm sure you've seen, the common advice in most cases, just if you get hurt, rest. And that's so far from actually good recommendations. So, and then for me personally, working with strongman, having knowledge of the sport is huge because when I've worked with individuals discussing altering technique for different purposes, someone has a bicep tear or has felt a bicep tweak during a certain lift, we can discuss ways that we can change that movement to either reduce their likelihood of it, ways that we can change their training to allow them to keep getting strong and work on getting ready for a competition if they're leading up to it with an injury, etc. Whereas I'm sure a lot of physios and strength coaches that don't quite have that knowledge aren't able to then help people adjust training leading into competitions or recovering from a competition.
Yeah, yeah. I mean, I assume that was the case. Kind of roll off that before we get into the specific. What is it? What differentiates doing PT work for like strength athletes and just being a PT, right? Is it just understanding what they need? Is it maybe being a little bit more liberal with pushing it a little bit harder? Or kind of what differentiates PT and strength PT?
So I'd say from my ability of reading research and practicing now for years, I don't treat strength athletes inherently differently than I would treat average people, other than the details of their sport.
Mm.
But I think that having my emphasis on strength and then all the research that's currently available, it encourages people to probably shift the way that practice is done. There's a huge emphasis in most rehab settings on passive care, things like massage, manual therapy, ultrasound, dry needling, etc. And when we just look across most of the research on this stuff, it doesn't seem to have a meaningful effect usually.
Yeah.
Maybe a short-term effect, but nothing substantial in the long term. In contrast, things like strength training, exercise therapy across different options like mobility, stretching, etc., these things consistently have superior results, especially for the long term, and offer way more benefits to people. And so whether I'm working with a strongman or a 55-year-old lady that has no experience with strength events, I'm probably going to view them generally through the same lens of things that I want to do with them. However, the things that will begin to differ is for the strength athlete, I have to have a consideration that they are looking to compete, they're looking to do specific events, etc. And so I'll probably get both to lift heavy. I'll probably get both to do really hard training across pressing, hinging, etc. But the strength athlete will have more specifics towards strongman.
Okay, cool. Yeah, I've been talking to Jeff Young and Dr. Andrew Mock, and they're getting really big into the medical fitness and really bringing that emphasis on strength training back into the rehab setting. Kind of like we were talking about, a lot of doctors. I mean, we know strength conditioning is medicine, right? I say health is just another name for fitness, right? And there are a lot of doctors, they don't have that knowledge. Not only do they not have the practical knowledge of how to do lifts, they don't know how to prescribe like an actual plan, a periodized plan. So but it seems like that's changing. It seems like there's a lot of different groups that are moving kind of bring this back in. Like, this isn't just for gym bros, right? There's actual health benefits. All right, cool. So let's jump into the first kind of real specific. So strongman, a very unique set of skills, strength, moving, anaerobic endurance, max reps, all that good stuff. What would you say? So this is obviously a big question. What are the biggest deficits you see in strongman athletes? What are we lacking in? What tends to be the root for a lot of our injuries? Maybe the ones top of your head, maybe top three or anything that comes out.
Yeah, so from my experience from working with strongmen and also looking at the research that's available on a lot of different injuries strongmen experience, there's a handful of things that I think would be beneficial for strongman/strength athletes to start to utilizing or incorporating a bit more. When we're looking at the upper body, a lot of strength athletes, especially strongman, are a bit more hunched forward, and just from the nature of deadlifting a ton, having things that we're carrying a ton, it just naturally curls you over a little bit more. And one challenge with that is when we start to look at something like the press overhead, we can see that there's a high demand on the ability to extend the thoracic spine.
Right.
If you're trying to flex your shoulder and you can't extend your thoracic spine, you're just not going to be able to achieve full shoulder flexion. And instead, you have to get it through some sort of other way. So if you have to get that bar overhead and you can't flex your shoulder the whole way, you're going to arch your lower back to a high degree, which there is some risk of injury associated with that. And so by working on some sort of thoracic range of motion, mobility, whatever you want to call it, drills, we can start to incorporate a greater ability to get overhead. So that might be things like sideline thoracic drills, a bench T-spine mobilization, some specific dumbbell pullovers, etc. Stuff that allows you to work into a fully extended thoracic spine and a flexed shoulder. just because, again, like strongmen don't generally do that kind of stuff.
Uh,
And fortunately, it's stuff that can be integrated into a warm up relatively easily, maybe in between sets, because it can be like filler work, etc. Another one that would be really beneficial, I think, for a lot of strongmen is doing some sort of bicep work. The reason I say that is if you look at the kinds of injuries that occur in strongmen, bicep tears are a somewhat common one. And if you also look at the training plans that a lot of strongmen utilize, you don't see a lot of necessarily elbow flexion work. And so by utilizing some direct elbow flexor work, we will improve the tolerance of the bicep to a more meaningful degree so that it can take on more load. In particular, if we consistently train it through a full range of motion with a reasonably heavy load, we might be able to hypertrophy the tendon, hypertrophy its connection to the bone, decreasing the likelihood of having some sort of a tear. It's not necessarily a thing that will stop all tears from occurring. If you have a flexed arm when you go to deadlift and it gets pulled straight, you still got that risk. But it will at least hopefully have somewhat of a effect to decrease your likelihood, especially on other things where, you know, like sometimes you see a bicep pull on like an Atlas stone or something.
Yeah, it's not.
And that might be an aspect there where the arm doesn't necessarily get pulled straight. It's just like the arm is contracting against a really heavy load, and it doesn't have any consistent stimulus to flex in that position. So by training it on a regular basis, it might help reduce that. Then if I were to go towards a couple other ones, like there's a lot that I think would be beneficial for strength.
Real quick,
just because
so bicep curls. We're talking just like really building endurance. Would you suggest like heavier weights or kind of like low weight 20 plus reps? What kind of rep scheme?
So because of the nature of the injuries that occur, I would heavily lean towards a low rep heavy weight bicep curl, something in the range of like 5 to 10 reps. And it should be like a close to maximal exertion. And I would honestly lean towards doing stuff like preacher curls if I were to pick something like that, just because when we look at the point at which the bicep is under most peak tension in a preacher curl, it's more towards the bottom range. And so it's going to be more similar to the types of stressors that we have in strongman, where, you know, you look at a Atlas stone, you look at a deadlift where someone might have their elbow bent, sandbag carries, other options where sometimes people have flexed elbows. It's almost always more towards a fully extended position where you have peak tension on the bicep. You rarely see someone hurt their bicep when their arm is highly flexed, super rare.
Yeah.
And so then if you're looking at like standing dumbbell curls, incline curls, etc., those are going to be ones where we have peak tension at a much higher elbow flex position, whereas like a preacher curl is going to be more fully extended. And then the reason for the high weight and low rep scheme is that when we look at the research on tendon adaptations, you need to have a weight that is at least roughly 70% intensity in order to legitimately stimulate for tendon hypertrophy to occur. So if you're doing 70% is the kind of like the cutoff. If you're below that, it's just not going to be a sufficient stimulus to really create some adaptation. In contrast, when you're above that, like a safe ballpark is like roughly 80%. So for most people, you know, somewhere between like a 6 and 8 rep max, you're going to be close to the right amount of reps and intensity to create a sufficient tension on the tendon to actually encourage hypertrophy.
Okay, cool. What about like eccentric loading, or just stick with full range reps?
Yeah, so if I were to think this out, earlier you were talking about how a problem is that a lot of doctors don't necessarily understand periodization. And so if we take our concept of periodization and apply it to the long-term training plan for a strength athlete, I would probably emphasize utilizing, you know, regular strength training. So, you know, isotonic motion, somewhat reasonable tempo, nothing crazy, in that, you know, low/mid rep range, heavy weight, et cetera, that we just discussed when you're further away from a competition. And then as you got closer to it, looking to incorporate, not super close, but let's say you're 4 to 8 weeks out from a competition, 4 to 12 weeks out, somewhere in that ballpark, utilizing some sort of eccentrics might be a viable option, because what it will do is it will then instead of actually training the tendon as much, it'll start to stimulate the adaptations within the muscle. We don't have, to my knowledge, any research specifically on eccentrics for the bicep, but we have that on other muscles, particularly like the hamstrings. And what we can see is that when you utilize eccentrics, we will often have changes in muscle architecture that are favorable for reducing the likelihood of a muscle tear. The reason I would leave that until closer to the competition is that these adaptations occur relatively quickly. Okay. And they don't take a long time to occur, and they do go away reasonably fast as well. So they don't stay forever. That's where, if you were going to be spending, like if you're going to do a competition, like right now we're basically October and you're like, hey, I've got to meet in April. It would be probably in your best position to go from now until February, just focusing on getting as much tendon hypertrophy as possible, maximizing that through the things that we just discussed. And then at that point, transferring over and going to some eccentric emphasized work. That way you will then have the ability to get the muscle to start to adapt and also get used to heavier intensities and loads that would then hopefully then put you in a position to be more prepared when you go into your competition, and also in the latest weeks leading into competition where you'd be pushing your intensity to the highest.
All right, cool. Yeah, I think it's interesting.
Oh, and in case it wasn't obvious, it's important, I think, to mention that if you're doing direct bicep work, whether it's the heavy work or the eccentric work, any of that, that should be like the end of a training session and not like the day before doing something that's going to be really hard on the bicep.
So don't fatigue the biceps before Atlas stones.
Exactly.
Okay. So one more. So we got the upper, the biceps, and the thoracic spine. What about some lower body? Is there any like one big lower body we're messing up?
Yeah, well, I'd say that in my opinion, that there's like probably two things that I think get missed in general strongman training. Number one is knee flexion work. And the reason I say for that is that if you look at strongman and some of the lower body injuries that occur, a hamstring pull is one that is probably on the higher frequency of lower body injuries that strongmen deal with. And so if you think about like sprints, so let's say you're doing a medley and you're running down to go back to the start of one, that's a time where you'll see someone pull a hamstring, like they just finished some tire flips, they're going down to get a sandbag and they sprint back trying to have a fast time on it, and they might pull their hamstring just as they're getting over. They're doing a really heavy deadlift, they get bent over and pull. There's a wide range of ways that someone might pull their hamstring during a strongman event. And when we look at the research on mitigating hamstring injuries, consistently the highest performing thing is Nordics. And the reason for it is like when they look at comparing Nordics to other types of hamstring work, they'll compare it to deadlifts, RDLs, other leg curls, etc. And generally we see that Nordics beat out all of these things for two reasons. Number one, it's direct knee flexion work. So all knee flexor work or direct knee flexion work seems to be really beneficial. So you could do leg curls instead of Nordics. However, the other side effect that seems to be really beneficial, as we discussed with bicep curls, is the eccentric overload. And so you're fighting to resist falling forward. And for a lot of strength athletes, if you're already doing a lot of deadlifting type action, which you're probably doing because it's super important for strongman, you likely don't get a lot of knee flexion work. And when we look at the hamstrings, the 3 of the 4 parts of your hamstring get stimulated really well with deadlifting, but one of them does not at all because it's only a knee flexor. And then we also see that building the beefiest hamstrings comes from direct knee flexion work. So for strongman, doing some sort of direct knee flexion work would be really beneficial. Then if I were to pick one more for the lower body, not making a huge list, I would say that I would probably pick some sort of calf raise. And similar to the last one, it's just really uncommon for strongmen to train their calves directly. Like you don't walk into a strength gym and see a lot of dudes, doing calf raises. And that's probably a really big disadvantage because if you watch a lot of strongmen, you will see calf tears or Achilles tendon ruptures pop up. And the best way to mitigate that is directly training the calf. And much like you asked earlier, like a lot of times when people do train their calves, if they do, is usually like this really high rep, like body weight only, I'll just do like one set to failure, etc. In contrast, just like with the bicep I mentioned earlier, our research points towards doing this lower mid-range rep work with a high intensity being the best. And so that might be one reason why a lot of strongmen don't train, is I think it's like, you know, not heavy, not hard, etc. I train my calves 2-3 times a week personally, not a lot of volume, like I do 2-3 sets, but I load up a barbell, get on a deficit, toss it on my lap. I'll bust out seated calf raises with a barbell. And I just recently did like 365 pounds for 10 reps. And you can load that stuff up, go real heavy, nice smooth tempo on it, and it lights up my calves, gets my Achilles tendon strong. Because like, I don't know about you, but the last thing I want to do is blow my Achilles tendon while doing like a run or a pick or a truck pull. Like I'm just not interested in that happening.
No, I'd rather not. Yeah, I've seen some of his videos. I don't know, man. Just the thought of my Achilles tendon popping is enough to make me maybe sit this one out until I can get that.
Yeah, that's the thing is like, it's a relatively, it's of tendon injuries, the two highest occurrences in strongman, to my knowledge, is bicep and Achilles. And yet, what are the two things that seem to be often highly neglected in strongman training? Bicep curls, calf raises. And so just like implementing them will have a huge transfer.
Yeah, I think that's easy enough too. Yeah, I'm not a PT at all, but one thing I stress to a lot of my clients is, you know, when we're talking about training, especially for strength, you know, our body is not just made up of muscle, right? There's muscle, and then you have your tendons, and you have your ligaments. You know, if you bust your ligament, you're out 6 months, a year. You get a bicep tear, I don't know, what, 4 weeks maybe. There's a range, but
it can be a long time.
Yeah, like, and still, your body's only as strong as its weakest link, its weakest link. And apparently my brain is today. And but yeah, a lot of these things we're talking about, you know, injury prevention, a lot of it's not even has to do with the muscle. It's actually you know, the ligaments and the tendons, so that you're not popping stuff. So I think just in general, everybody needs to kind of understand that. Even general pop doing your bodybuilding, we go to the gym and the only thing we're thinking about is muscles, right? But there's bone growth, there's tendon growth, there's all these other different factors and benefits, right, that we need to consider when we're choosing exercises and developing a plan. So yeah, I mean, hopefully maybe after this interview, we'll see more people at the calf raise after the deadlift platform. So